We see some major differential diagnosis, that is differential diagnosis of major lipid abnormalities. Differential diagnosis of major lipid abnormalities. So first lipid abnormality is a hypercholesterolemia. You see, what does it mean by hypercholesterolemia? You know that cholesterols and triglycerides, the lipoproteins, do you know there are 6 classes, major 5 classes and one more 6 classes of lipoproteins, which are lipoproteins transports plasma lipids, and these lipoprotein contains many triglycerides, cholesterols. So this hypercholesterolemia is a condition where the cholesterol levels are very high. Okay, so the condition is called hypercholesterolemia. The primary disorder is polygenic familial hypercholesterolemia, familial defective ApoB100. You know ApoB100? ApoB100 is an apolipoprotein. You know what is apolipoprotein? Apolipoproteins are a component of lipoprotein. So lipoprotein transports lipids. Inside the lipoproteins there are triglycerides, cholesterols, esters, free cholesterol, phospholipids, apolipoproteins. So LDL is a, so that is about the primary disorder is the hypercholesterolemia. It can be polygenic. It can be a polygenic disorder, or it can be a familial hypercholesterolemia. It runs in family. The familial hypercholesterolemia is also autosomal dominant condition. Okay, next is another problem, is a familial defective ApoB100. So what is ApoB100? You see this is a structure of LDL cholesterol. You can see the ApoB100, which is a apolipoprotein attached to the LDL cholesterol. Similarly in VLDL and IDL and LPA, that is lipoprotein A, in these lipoproteins also ApoB100s are seen. So this is a lipoprotein which contains like triglycerides, esterified cholesterol, unesterified phospholipids, several and apoproteins. So if there is a defective ApoB100, there will be familial hypercholesterolemia. So we have a doubt that why this just a apolipoprotein, this B100, why this defective ApoB100 causes hypercholesterolemia? Because the familial defective apoprotein B100 is autosomal dominant genetic disorder of lipid metabolism, and they are associated with hyperlipidemia and elevated atherosclerosis risk. So familial defective ApoB100 is caused by mutation in ApoB condition. There will be mutation in ApoB protein, mutation of ApoB lipoprotein. So that reducing the binding affinity between apolipoprotein B100 and the LDL lipoprotein receptor. So if this is an LDL lipoprotein, if this has a receptor, this ApoB100, this is ApoB100, this affinity is reduced. That is because of this mutation. So remember that. So that is about, so likewise if it is not affinity is not good, the carrying capacity, the LDL cholesterols will be higher. There will be lipid metabolism disorders. It causes the impairment of LDL catabolism, resulting in increased levels of LDL in blood. That's it. Next comes another disorder called another disorder is called hypertriglyceridemia. Triglycerides, since a lipoprotein contains triglycerides and cholesterols and certain other esters and free cholesterols. So familial hypertriglyceridemia is a condition where the primary disorder is in the, what is the primary disorder in this condition? The primary disorder is lipoprotein lipase deficiency. Does it cause any problem? The lipoprotein lipase deficiency. What is lipoprotein lipase? Hypertriglyceride. So this is lipoprotein lipase deficiency. It's a autosomal recessive condition. Okay, it's a autosomal recessive disorder of lipid metabolism. So it is a there is a characterized by severe triglycerides and chylomicrons. Triglycerides and chylomicrons. Early diagnosis and early dietary modification should be there in these such conditions. So what is the role of lipoprotein lipase? This lipoprotein lipase actually it breaks down the triglycerides. The lipoprotein lipase breaks down the triglycerides to free fatty acids. So if the lipoprotein is deficient, if you see the deficiency of lipoprotein, there will be increased triglycerides level in the blood. So that is the problem here. Similarly, another primary disorder in hypertriglyceridemia is ApoC2 deficiency. Similar to ApoB100 deficiency. ApoC2 is especially seen in chylomicrons, VLDL, ILDL, HDL, and also ApoA5 deficiency. In familial hypertriglyceride and bis beta lipoproteinemia. These are the conditions, the primary disorder of hypertriglyceridemia. Here I forgot to mention the secondary. This is the primary disorder. And what about the secondary disorder? The secondary disorder can be hypothyroidism, nephrotic syndrome, it's a hyperlipid condition. Next, anorexia nervosa. That is the secondary disorder in hypercholesteremia. So the hypertriglyceridemia, the primary disorders we have discussed like LPL deficiency, ApoC2 deficiency, A5 deficiency, familial dyslipidemia. Next, the secondary causes. Secondary disorders include diabetes mellitus, one of the major problem, obesity. Next comes metabolic syndrome. Then alcohol use. Then oral estrogen. Then renal failure. Hypothyroidism. Then retinoic acid. Lipodystrophy. So these are the secondary causes of a secondary disorder with causing the hypertriglyceridemia. Next come third variety of a lipid abnormality, that is a combined hyperlipidemia. In combined hyperlipidemia, it's a condition where the primary disorder is a familial. Next is dyslipidemia. These are the primary disorder. Then come the secondary disorders. Secondary include diabetes mellitus, obesity, metabolic syndrome, nephrotic syndrome, hypothyroidism, lipodystrophies. These are the primary and secondary causes for combined hyperlipidemia. Next comes the fourth part, that is low HDL, that is the high density lipoprotein, low HDL. Low HDL. In low HDL, the primary disorder lies that is a familial hypoalpha lipoproteinemia. Next comes Tanger disease. So Tanger disease, what does it mean? Tanger disease is characterized by a severe deficiency or absence of HDL in the circulations, resulting in tissue accumulation of cholesterol esters throughout the body, particularly in reticular endothelial system. Okay, so it's a absence of HDL in the circulations. See the yellow deposition, there is cholesterol deposition on the tonsils, diffuse hazy corneal opacity, histological findings in tissues. See this cholesterol deposition in the tonsils. Say salient feature in Tanger's disease where the HDL is absent and there will be lipid abnormality, depositions of cholesterol. The carrying of cholesterol is affected in this condition. So that is Tanger's disease. Next primary disorder of HDL low is ABCA1 deficiency. What is ABCA1 deficiency? ABCA1 deficiency means ATP binding cassette subfamily A member 1, that is deficient, that leading to a low LDL. Similarly, A1 deficiency, we see LDL contain A1, A2, C1, C2, C3E, these apolipoproteins. If any of these apolipoproteins, especially A1 is deficient, it can affect the composition of the HDL and it will be low. Similarly, lecithin is to cholesterol. Acyl transferase, deficiency, it is LCAT. So it is a primary disorder. Coming to the secondary disorder of low HDL, we see conditions like diabetes mellitus, obesity, conditions like metabolic syndrome, conditions like hypertriglyceridemia, conditions like smoking, anabolic steroids. So these are the main lipid abnormalities, major lipid abnormalities, differential diagnosis. Thank you for listening. Have a nice day.